Welcome to the program, just like the song says. My name is Rebecca Rainier. I'm so glad you're here today. It is October. It is National Breast Cancer Awareness Month, and you see a lot of things on the news and on television. We're trying to do something a little bit every week different to bring to light a different topic. We have talked about gland problems after breast cancer treatment in the last few weeks, but today we've got something it might be a sensitive topic for some of our viewers, but ladies, we can talk about this. So be warned, you've got a 12-year-old run along. All right, joining me today is Dr. Andrew Croak, and you have the reason I immediately wanted to have you on is kind of the first thing. 1 in 8 women develop invasive breast cancer over the course of a lifetime, and we talk about the different treatments, and we talk about reconstructive surgery. We talk about options like we were talking about gland problems the last couple episodes, but you really focus on intimacy can be a huge problem after breast cancer treatment. Talk about the problem that women face.
Sure. One problem that breast cancer survivors and postmenopausal women in general may suffer from is vaginal dryness. So it connotes the Genitourinary Syndrome of Menopause. So anything from symptoms of vaginal dryness, painful intercourse, or bladder symptoms like urgency and frequency may fall under these problems.
Is that due to the hormone changes or the treatments, or is it a combination of everything that's going on?
A combination, in fact. So, the naturally menopausal woman may experience these symptoms, but when a woman undergoes treatment for breast cancer, either anti-hormonal, anti-estrogen treatment, chemotherapy, or even surgical removal of the ovaries, this can compound those symptoms tenfold.
And it throws your body into menopause immediately.
It does. It does.
All right, so I want to let everyone know that you're the medical director at the Northwest Ohio Center for Urogynecology and Women's Health in Maumee, Ohio. And throughout the interview here, we are pulling up your website. You do a lot of different things for the treatment of women, kind of a spectrum of care for different issues that women face. But again, we're talking about something specific here. You have a procedure that you say patients say is life-changing. The other word was game changer. So a woman comes to you who is finished with her breast cancer treatment. Is that when the process begins?
That, or even during treatment.
Okay.
Or in the naturally menopausal woman, just because she's suffering with this, usually in silence, or the partner may call the office.
She is embarrassed. She doesn't know who to talk to. She thinks it's trivial compared to the breast cancer situation.
Correct.
So guess what? It's not. This is your health, and you have a question about it. You need to step forward and ask about it, because there are things that can be done to help and to return your life to one thing you're never going to be is the same after a major event, but you can find a new normal. And it's the same thing with pregnancy. It's the same thing with a family, trauma. And this is the kind of thing we're talking about here. Give yourself a new normal.
Yes.
Okay, so what's the procedure that we're talking about today?
Sure. The Mona Lisa Touch is a fractional CO2 laser treatment that is used intravaginally to help re-stimulate and revitalize tissue that otherwise would have a lack of estrogen and be very irritating or dry. And
the question is, what are the indications? When you're going to maybe decide this is good for someone?
Sure. This laser has FDA indications through the 510K process, which is a technical term for critically looking at a device for safety reasons, but it is indicated for incision, excision, or ablation of tissues. It's used in everything from gynecologic to plastic to dermatologic to orthopedic surgery, but in urogynecologic terms, it's used to stimulate new vaginal tissue growth or healthier vaginal tissue growth.
And is it a painful procedure?
No, that's what's so novel about this laser, is that a woman can come into the office, have a 5-minute treatment that is painless without any anesthesia or injectables, and be done and move on with her day.
And maybe, again, come back to some sort of new normal in her life.
Correct. Data in both Europe and the United States, as well as my personal experience with over 70 patients in doing this procedure, has been even after the first procedure, we're seeing tremendous improvement in symptomatology.
What is the course of treatment? How many times, what's the kind of commitment that is typical?
Yep. 3 treatments about 6 weeks apart. So 3 5-minute treatments.
That's not too much of a commitment.
No,
Okay.
no, not at all.
And you were touched on a little bit clinical trials, though, conducted on this procedure, on the Mona Lisa Touch, so that you
Correct.
feel confident in assuring women that it's safe.
Right. I think at our center we always back up our therapy and our treatment offerings based on good data. The data is excellent in European literature and in multi-center trials here in the United States. It's showing over 90% improvement.
So then we get down to it. Is this covered by insurance?
No, it is not, since
Okay.
it is a newer procedure.
All right, so it's newer. So if this is something, though, that you're affected by, concerned about, interested in, because we're talking about it, what kind of costs are associated
Sure.
with it?
Across the country, costs may range from $1,500 for all 3 treatments to up to $3,000, more so on the coasts. I think what women have to take into effect is that when you spend money on vaginal estrogen creams, or you don't want those creams, they aren't covered, or the overactive bladder medicines and therapies, those costs can quickly scale up and exceed the cost of the laser.
So you need to compare
Absolutely.
what treatments are being offered for.
Absolutely.
Do you have to have a referral to come to your
We
clinic?
do have many gynecologists, family doctors, and oncologists referring patients to us for this treatment, but you certainly can reach out to my website, to smilemonalisa.com, or
And
call
that
my
national,
office.
that will link to back here to wherever. So whoever's
Correct.
watching this, a lot of people watch online, you can go, we'll link to that, smilemonalisa.com. So you would be linked here to your office.
Right.
If you're in this area. If you're watching online, it'll link you to the wherever procedure closest to you if you have questions.
Correct.
Again, we're going to have his website all set too. If you have questions, if you're suffering and you don't know who to turn to, it's definitely a call to make. You can have a consultation. Is a consultation going to cost us anything?
No, that is
Okay.
usually put through on your normal insurance.
Okay.
So, and then if we have promotional programs or educational lectures, we often will offer an incentive discount.
So there are times that it can even be less financially impact
Absolutely.
on you. All right, thank you so much, Dr. Croak.
Thank you.
Great topic for us today. Again, we will have the website linked on 13abc.com/full-plate, so you can get all the information. If this is something that you need more information, definitely go to the website. All right, when we come back,